Hi, my name is Brittany, and I basically want to share with you guys my birth story. So, I'm currently I'm pregnant with my second, and um, my first labor did not go as planned. And so, I want to talk to you guys a little bit about what I'm doing to prepare for the second one. So, hopefully, I get a better birth experience. So, my goal for the first pregnancy was to have an unmedicated birth, natural. Um, Pretty much just wanted to have the baby at home, but that wasn't really an option. So, not because I was high risk, but I just didn't really look into it because I wanted to make sure my insurance covered the birth of the baby because I was worried about money, which I would advise that if that is your case, I would at least look into it. I wish I would have. I wish I would have looked into midwives and I wish I would have looked into it to see what the cost difference would have been because my insurance may have covered it. And then on top of it, you really, it's a huge deal having a kid, and it's life-changing. So I think that it's worth it to figure out, how much extra it's going to cost, and if it's something that you can afford, if, it is out of network or something. So yeah, that would be my advice. So, and let me tell you why. So, the hospital that I was going to had very strict policies on their in their labor. They were actually baby friendly, which I really liked, but I didn't realize how strict the rules were in the hospital itself, and that I can't really. That was my fault. I mean, I never looked into it, so I should have. So pretty much. My doctor was a group. It was a group of doctors, which I only saw her, and she was my gynecologist, which she was a very good gynecologist. And so whenever I got pregnant, I just stuck with her because I did like her as my caregiver for that. So I decided to see her through my pregnancy, but I quickly felt uncomfortable with her because as a first-time parent, I didn't know a lot of stuff, and I was reading a lot of stuff on baby apps and everything, but whenever I went in for my appointments, I felt like very rushed, and like there was no explanation of what I should expect. Whenever I told her about any pregnancy symptoms, it was like, okay, yeah, those are normal pregnancy symptoms. Anything else? All right. Meeting adjourned. The appointments were very quick. I mean, less than 10 minutes. It was very rushed, and I really didn't care for the care I was being given before birth, before labor and everything. This should have been a red flag, and I should have seeked out other providers, and I didn't because I was scared to really look around because I figured like this is probably how they're all gonna be, and I shouldn't have had that. That's a misconception. You should definitely go and check out other providers, and you should keep looking until you find someone that you are comfortable with. I would definitely highly suggest that. So pretty much like we got, so that was kind of my experience overall. The appointments were pretty much the same, very rushed and just not my cup of tea. So let me get into the laboring part. So on my due date was February 19th. My last appointment with her was I guess I would have been 38 weeks. And I thought the baby was going to be in there forever, which I was okay with because I actually felt I loved my third trimester. And I was like, I know what comes after baby. I was like, it's a lot of work. So I'm like, I'm okay with a couple more weeks of getting to do what I want to do. I was already off work. So I was planning on really enjoying it. And I did get to enjoy quite a few weeks before because I had left my job early enough. But still, wasn't expecting anything to happen. I didn't want to get checked or anything, so I didn't get checked to see if I was effaced or if my cervix was dilated. So Saturday rolls around and it is February 10th and it's about 7:30 at night. Me and my husband are watching TV and we decide to go to the movies. And we're going to go see this movie, The Post, actually, if you remember that being out. We want to go see that. So we get up to go see that movie. I go downstairs and I feel like a trickle in my underwear. And I'm like, yeah, I'm pretty sure I did not pee myself because I know that sensation of peeing and it did not feel like peeing. It felt like my water breaking because I had watched so many other videos. I mean, I did do a lot of research, but I didn't even touch enough, which just in case you don't watch this whole video, I'll just insert and say, check out the Bradley method. I feel like some of it's a little bit like maybe much, but I do feel like it's definitely something I recommend looking into. I think that there's a lot of really good information there. And even if you're not like, I want to go along with everything on the method, I think that it's definitely worth taking time to look at because if you want a natural birth, I would say that if you want a natural birth. Which doesn't mean that just because if you decide that you want to get the epidural or something, it's not something to look into. Like I would still look into it. Because if I'm being honest, like I wouldn't go into pregnancy saying like, oh, I'm going to get an epidural or I'm not. I mean, I am kind of going in there going, I'm not getting an epidural, but you'll understand why. But I wouldn't set your mind on that you're going to get an epidural because you might not have that painful of a labor and you might be able to do without. And really, I think, if you look into it, it's probably better to go without, and not just because people are like, oh, you'll be on drugs and it affects the baby. I mean, there's a lot of benefits to the mother too. So you really need to go off of how you feel, I feel like. Like if you go in there and you can't handle the pain and you're like, I really need this, then you probably should get it because it's going to help you relax and have an easier labor maybe. And that's not a guarantee though. But that choice I think you should make when you go in. I don't think that you should make that prior to because like I said, you might not need it. And then there's a lot of benefits to not getting one, which I think you should look at. So where was I? So my water broke. But it was like a trickle. It was a very light trickle. Excuse me. So basically it was just trickling. And I had read that, so the hospital recommended that if my water broke that I needed to come in right away to see about, to make sure that there wasn't an infection, that I wasn't going to get an infection and stuff. So I called my sister, she's a nurse, and I pretty much just asked her, I was like, hey, I said, I think my water broke, and I'm like, do you think that I can go to the movies, or do you think that I need to go to the hospital? And she, of course, was like, you need to go to the hospital. So, hindsight, if this happens again this time, I'm going to the movies. I am keeping my mouth shut and going to the movies. You will see why. So my plan was to labor at home. But of course, like, my water broke, so I felt like I needed to go in because I wanted to do things right, as far as, like, I didn't want, even though I wasn't that comfortable in the hospital setting, I didn't want to, I didn't want anything to happen to me or the baby. Like, my water breaking was really unexpected. It really actually doesn't happen. I think they say like 10% of women, their water breaks. So I was lucky 10%. So I'm hoping that doesn't happen this time, at least not until like I'm in full blown labor. Because I forgot to mention, I wasn't having any contractions before my water broke. And I really never felt any Braxton Hicks contractions in my pregnancy. Not that I could, just checking the time. Not that I could tell anyways. So it wasn't like I was like in labor and then my water broke. It was like my water broke and then basically I started having contractions afterwards, but it did take a while. So I called my sister and she was like, yeah, you need to go to the hospital. So I got the hospital bag. I told my husband, my parents, because we were actually staying there. And I was like, hey, my water broke. So Tiffany thinks we should go to the hospital. So that's what we're going to do. And I wish I would have called first because I didn't. And even though, like, I knew it was my amniotic fluid that was leaking. So like I knew, but I wish I would have called because, I think it just would be better to call and just be like, hey, this is what happened. Do you think I should come in now? Because, even though I think that hospital would have told me to come in, they may not have. So I do feel like I take a little bit of responsibility of that because I may have jumped the gun a little bit. Like, I probably should have just called just to be sure they wanted me to come in before I just headed off that way. So I wasn't in a hurry though. I mean, my husband was freaking out, but I was like, I'm like, it's okay. But he's just like that. So, my sister actually came over though, and she actually drove us to the hospital because, like I said, my husband doesn't do well with stressful situations. And for him being a first time dad, like, he was kind of like, freaking out a little bit. So we get there and, which they had me fill out paperwork when I got there, which I wasn't like too crazy about because at this point I was having contractions and they really weren't bad, but I just like, who wants to fill out paperwork, especially like when they're like in labor. So this time I'm going to try to register early with the hospital that I'm going to this time. And I would recommend that if there's any way that you can register early, so maybe you don't have to fill out paperwork. I don't know how that works or if every hospital does that, but I would check that out. Just so that when you go in, you don't have to worry about it. You just go in and they like admit you or send you home, which I would recommend not going in too early too. I mean, but everybody's different, as far as like some people just want to get in there and, get checked and stuff like that. And I get that. But I mean, first of all, I don't think you want to make several trips to the hospital. And then second of all, like, you're going to be more comfortable laboring at home. So that's just my advice. So, to get the ball rolling. So I went in, filled out the paperwork. They took me back. They checked me and it was my amniotic fluid leaking. And at that point, I was seeing a resident was on call, or a resident was there. The doctor that was on call wasn't there, so it was just a resident. She told me that hospital policy is that once your water breaks, that you need to stay in bed. I did not know that, and I was planning on like being able to sit on an exercise ball and walk around, and so that really upset me. they were basically like, they weren't gonna even let me get up to go to the bathroom. That really upset me too, because I was like, I did not want to pee in a bedpan, and I wanted to be able to get up and walk around and everything. So I was like really upset. So that was like number one thing that like started this whole process off like on the wrong foot. Then once I got to my room, they put the IV in me, and I had requested that I not have an IV, and basically they said that they might not hook me up to fluids, but they would need to do like an IV thing, because just like hospital policy. So that was number two. That was like bad. So the nurse actually told me that she would just hook it up and make sure the line was going, and then she would take it off, and she never did. And I didn't ask, and I should have, but just so you know, like, I was like hardly in labor. Like, my water broke, which is why I was there. But my contractions were like pretty mild from what I remember, and it has been a while. It's been like, you know, my son's gonna be 16 months here. So, I mean, it was a long time ago, but they were definitely not that painful. So, so they had me hooked up to an IV, and then a blood pressure cup, and a baby monitor. So, I mean, this is like very early stages of labor, and I've got all this stuff on me. I mean, it was very like stressful and uncomfortable. Not to mention, it was like, at this point, it's like probably like 9 o'clock at night. I mean, you know, I've been up all day, and now I'm in a hospital, like supposedly gonna give birth to a baby. Like, I mean, this sucked. So, and I don't like to have a bunch of stuff strapped to me. I mean, it was really uncomfortable. I couldn't get out of bed. So they brought me a peanut ball, which is kind of like an exercise ball, but it's like smaller at the top and then bigger at the bottom. Kind of reminds me of like a cootie, if you ever remember that game, without all the legs and head and everything. But pretty much like you put that between your legs. It's supposed to help you dilate. I don't know, like it may have, I mean, there was just a lot of things that like just didn't happen for me, but that's okay. I mean, it is okay, but it's not okay. Like, it is what it is. I can't change the past. So, but let me see. So, what am I trying to think? So they brought that in, and then what happened next? Oh, so I tried to take a nap. So I did fall asleep for a little while. I don't remember how long I fell asleep for, because honestly, like, I was super uncomfortable because, like I said, I had all this stuff strapped to me, and so it was, I think if I would have stayed at home, like, I probably wouldn't have fallen asleep. And like, I mean, of course you're excited and your adrenaline's going because you're like, oh, the baby, it's like coming. And I was surprised because I wasn't expecting to come that early. Like, I really thought that I was going to go past 40 weeks because I just felt like the baby was like so in there, and I hadn't had any contractions. I didn't practice contractions, not that I could feel. It was my first time, so maybe I was having them, I just didn't notice. But you know, I was able to finally like sleep a little bit, and then I really don't remember. So they did check me at some point, and I think I was dilated to like a 2 or a 3, but I was like not very far along at all. And then they come back again later and checked me again, and I was like at the same, like I hadn't moved. Like, I mean, like my labor was going like nowhere. So pretty much like they came in, and yeah, I think it was that next morning, and they pretty much like, there really wasn't a lot going on, to be honest. Like, there's not a lot to say before this because the contractions were about the same. They were pretty mild. I wasn't allowed to get out of bed. I was kind of sitting on the edge of the bed and kind of testing it, like, but the baby monitor kept on like falling off, and they kept on coming in and being like, Oh, the baby monitor's off. The baby monitor. I mean, it was so stressful because I'm like, who cares? Like, leave me alone. Like, let me like labor, you know? Like, I was so annoyed. And so like nothing's happening, and they come in and they're pretty much like they wouldn't give me an exercise ball, and it was just dumb. And so they finally come in and they're like, hey, the doctor wants to put you on Pitocin, which I didn't want. And basically I just asked my sister, I was like, I don't know, what do you think? I was like, I don't want it, but I was like, I realized that I'm not going anywhere, and basically I wanted to do anything and everything to avoid having a C-section. So I was like, if I need to do the Pitocin, because my water broke, the hospital policy is that they really want the baby out within 24 hours. And this has been like 10 hours later. So like, and I wasn't going anywhere, like nowhere. I wasn't even progressing a little bit. The contractions really hadn't been getting any worse. Like they stayed pretty much the same. So I didn't really know what to do. And she was basically like, it might be something that you want to look into because it could help you progress and whatever. So I agreed to go ahead and do the Pitocin. Well, at the same time that I agreed to do that, another resident came in and told me that my doctor would let me get on an exercise ball, that she thought that that would be fine. And so they finally brought in the exercise ball. Well, I already agreed to the Pitocin, and so they'd already started the Pitocin drip, like pretty much simultaneously, like as they brought the ball in. So I don't, there's a lot of things that, I don't know exactly what was going on, but basically I got on the exercise ball and they'd start the Pitocin drip, which I never felt the contractions get any stronger, but they quickly stopped that because the baby's heart rate went up, and so they stopped the drip. So basically like everything was fine until they started the Pitocin. And I mean, maybe it had something to do with me being on the exercise ball, but I don't think so, because like I said earlier, I was kind of sitting on the edge of the bed and kind of testing boundaries anyways. So I don't feel like getting on the exercise ball really had anything to do with it. But anyways, needless to say, Timothy's heart rate went up, and they made me get back in the bed and then sit there. And then 30 minutes went by, the baby's heart rate was still up. I was like having like a full-on like anxiety attack practically, because I was so frustrated, because I felt like I was just being told to just sit there, and like I'm like, I want to like do something to get my labor to go. And it was just like, no, just sit there and we'll just see if you pop out a kid. Like, that's not usually how it works. I realize that some women might progress like, just naturally, but that's usually not how it works. Usually you need to like be doing stuff, I feel like, or I don't know. I mean, maybe not. A lot of the stuff I'm reading, it's kind of like not like that, but I just heard, I mean, I was like laying in bed. So I feel like I have read a lot that says like when you're just laying down like that it slows your labor. So, I mean, I really do feel like, I don't know. I mean, maybe I just needed more time. I think ultimately I needed more time to progress, but once his heart rate went up, then they were worried about an infection. And so they basically came in and told me that I was going to need an emergency C-section. And yeah, that was it. Like, I didn't have a choice. Like, they're like, the heart rate's been up for more than 30 minutes. It was up at 180, and we're taking you back to have a C-section. Like, that was it. So, of course, like, I was like extremely upset, because here I was wanting this natural birth, with no like interventions, and I'm not even kidding. I'm like, not like, this is like complete opposite of what I wanted. So I went back, and pretty sure they did a spinal tap. I was trying to calm down, because I was like, at this point, I'm just like, oh well, like, this sucks. I can't do anything about it. I wanted to leave the hospital. Like, I really wanted to walk out. And I knew I couldn't because I'm like, where am I going to go? Like, I can't just like walk out of the hospital. So I'm like, um, yeah. I mean, I really don't know what else I could have done except for when I first got in there. I do wish I would have just said basically like, I'm going to do what I want to do and you can just suck it. Like, I wish I would have just continued to walk around, go to the bathroom, and do whatever I want because really, you know, you can. And I was trying to be, I guess, a good patient and listen to the advice of people that I thought were, you know, caring for me, but I don't think that that was the right decision for me personally. I think that I should have just done what I wanted because I think it would have turned out better. I think that they were advising me wrong, and that's definitely going to be different this time around. So pretty much, I went back. Nurse was with me. She was really nice, and I mean, that was a lot of reason why I was upset too, is because this was my first kid, and I was like, I want to have several more, and like starting off at a C-section just makes it that much more difficult to go back vaginally afterwards. Or at least it makes it higher risk. I wouldn't say that it makes it more difficult. They put you on a higher risk. So you just don't really want to have to deal with that. So basically, you know, they put the spinal tap in, and I pretty much like, I felt like I was gonna die. I think my anxiety was so like, I don't have high anxiety, but I definitely was like having a panic attack, and I felt like crap. Like, I just felt like I just wanted to die. Like, I just wanted it to be over because I was basically kind of like hyperventilating. They actually did put oxygen on me because I wasn't really breathing, because I was just like, I don't want to do any of this. I don't want, like, I'm like, I don't know if you've ever been in a situation like that, but I was like, I just don't want to do this. Like, I want to like leave. Like, and you can't because you can't, you know. So I don't like, because of that and because of the, you know, all the drugs that they gave me and stuff, I really don't remember a lot afterwards. But basically I just remember like I couldn't feel anything. Like, that is one thing. I mean, I didn't feel anything. I mean, when they cut me open and took the baby out, like, I don't really even remember feeling tough. I mean, like, I remember my body moving, but it was like an out of body experience. I was just like sitting there, just like looking at myself go through this, just like, you look pathetic on this table. I couldn't feel like I started not losing feeling in my arms. In fact, they were asking me questions to keep me alert and awake. Like, what's your name? What's your date of birth? And I was getting really irritated because I was super tired because they drugged me up, and I, like, you know, whenever you go on an emotional like wave like that, it's like a hard crash. So I was just like super exhausted, and I just like I said, I just wanted to like kind of just like disappear, just like melt into nothingness at that point. I mean, I'm not even really thinking about Timothy. I'm not even thinking about like, oh, I'm about to have a baby. Like, no, I wasn't like excited. I was like mortified, like like, yeah, just like I felt like I was gonna die. So basically I'm just laying there, and then you know, we decided not to find out the sex of the baby. So whenever they pulled him out, I remember them saying something to my husband like, it's a boy, and which I was excited. I mean, I was excited to have a boy. And so they took him over to the table or something, and they were, I think, just checking to make sure he was okay because his heart rate had been elevated. And they checked us for infection, and they didn't find anything. So I don't know why his heart rate went up, but pretty much that's then they brought him over to me, and I got to hold him. But like I said, I was like really out of it. I really didn't get to, I mean, I can't tell you, like, I was like, oh, you know, the baby. I didn't feel any of that. I felt like I had just had surgery, and and I was drugged up. Like, I didn't know really what, I was so numb, I couldn't even have an emotion. Like, that's how I felt. So my personal take on it, now I realize people get C-sections all the time, and I think if you go in with a planned C-section, or if maybe you're more open to it, I just really didn't want one, and so I think that caused a lot of negative feelings with the whole experience. I think I wish that I would have, even though, like, I wish I wouldn't have ended up like that. I wish I would have, like, got inside my head a little bit more and been like, you know what, you don't have a choice with this, so let's just go with it, you know, like, just go with it, make it a good experience. And maybe I would have still reacted the same way to the drugs and stuff, but I feel like it may have been a little bit better. So, yeah, then after that, they took me to the recovery room and, you know, all that. But, you know, like, I just didn't get the birth experience I wanted. I did have trouble with breastfeeding, and part of me wonders if it's because I didn't get quite the skin to skin that I was hoping for after. And I couldn't tell you how long it was because I don't really remember. And, but it was probably only about like 5 or 10 minutes before they put the baby on me. It might have been less. But then when they moved me into the other one, I mean, I was just really out of it. Like, I was kind of like, whatever. I mean, because I was just so out of it. So, you know, I would just say that, you know, I learned a ton from that experience, and I know that this second kid will be a completely different experience. Even if it ends up in a C-section, it's still going to be completely different because I just know so much more now than I did. So I'm actually going to stop it here, and I will tell you about my other plan for this baby on the next video. Thanks for tuning in.